This is a case of a 11-year-old boy who presented essentially with a lump behind his knee for about 6 months prior to seeing me. There was no injury, there was really no pain in his knee. Ultrasound did show a Baker cyst. We did an MRI because I was concerned for any kind of intra-articular pathology, and we did actually find a very subtle osteochondral defect at the posterior medial femoral condyle. After about 3 months of rest and avoiding any sports, the Baker cyst went away. So here's our 11-year-old boy complaining of about 6 months of a lump in the back of his left knee, and really no symptoms other than just this lump. Physical exam really didn't show much other than a large mass in the back of his knee. Here's our sagittal view, and we can see the Baker cyst. We can see the semimembranosus muscle transitioning into the tendon, and you can appreciate how thick his hyaline cartilage is over the medial femoral condyle, and this is typical in the pediatric population. You can also see the medial gastrocnemius muscle and tendon nicely here as well. Here's an axial view. Again, you can appreciate the Baker cyst, and does have a nice thick septum within it as well. And you can see that stalk of the Baker cyst that goes between the medial gastrocnemius tendon and the semimembranosus tendon. And here's that subtle osteochondral defect over the posterior medial femoral condyle, which I believe was the cause for this Baker cyst.